Hey, this is Andy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this story episode, we're talking mental health.
And we are actually not just talking mental health this episode, but we have next episode as mental health.
Yes.
As well as some bonus content. We have we did a webinar on mental health for FLATA Student Leadership Committee, and we do have the recording for that one. So we're going to post it up on our YouTube. And that one is more specifically about mental health EAPs, case studies that we've had to deal with of mental health, and a little bit more hands-on action steps. So,
well, you got me nervous when you said we had bonus content of mental health. I was like, oh, we
already did it.
We do? I didn't know. I do know. I do know. I was at that seminar too.
Yes, sir. So specifically for this episode, we are going to be talking not only about athlete mental health, but also athletic trainer mental health.
Which I think is huge. And I think it doesn't get talked about enough. Like, we're so focused, well, as athletic trainers to begin with, we're so focused on our patients and athletes,
right,
as opposed to ourselves. But anytime you talk about mental health, it's always, the stressors that student athletes are under, which they are under a ton of stressors. Mm-hmm. But it's not very often talked about the athletic trainer.
Mm-hmm. So I kind of kept those for the end. But before that, we do have a couple of the more extreme mental health stories.
Okay.
And then we have how people have seen it affect, like, playing time.
Okay.
And then when an athlete does open up, what do you do? So we have some questions asked that people submitted. We have ways to kind of lead that conversation. We have ideas of certain certifications and stuff.
Ooh, nice.
Some different coping mechanisms. So there's a lot going to be packed into this episode.
Awesome.
So do you have anything to start us off?
I feel like you've dealt with a lot of mental health. Actually, I feel like you dealt with like a ton of mental health, and I had none.
Yep.
And then
now look at you.
It kind of like, I don't want to say it switched.
Yeah.
But I've been dealing with a lot of mental health at my place right now.
Yeah. Now look at you. It's finding you.
Yeah. We're so lucky. We have a director of social wellness / licensed marriage and family therapist who is employed on campus specifically like full-time for mental health. And she does respond if we call campus police. And she also is the person who I've had multiple conversations with her specifically for athletics because we've had a lot in athletics. But if I make a report and even write athlete, she's the one who will follow up. And it will be within 24 to 48 hours, depending on the situation.
That's awesome that she would respond with police as well for a psychological emergency. That's really dope.
And I've had too many conversations with her recently because we've been dealing with quite.
I mean, at least it's being used.
Absolutely.
Like people are willing to, it's better than like not having to use it at all because you know the problem's there.
Well, here's the thing is like she is actually just that position is new for our school. And originally we had luckily we didn't have that many mental health situations arise previous to her coming on board. Which is so good because the school's way of dealing with mental health was sending the kids through this app.
Oh, okay. That's annoying.
The app, like we had someone call, like one of the people through the app, like tried to call our athlete 3 times at the same exact time. And it was during their practice.
Oh, yeah.
And then the kid was like, I can't answer that. And then the app was like, oh, well, we can't get a hold of this person. You obviously don't want help. Wow, that is not a way to respond to mental health.
Now, do you think you're seeing a large amount of student athletes using your service now because it is readily available?
So I was thinking about that, but we also have done more screening tools.
Oh, good.
Which, okay, like that's not the only reason why we've had more though.
Yeah.
Because I've also feel like I've been catching it a lot more. Like I've caught a couple of kids, like 2 to 3 kids this semester. I've seen cut marks on them.
Okay.
And so like that's not something that like I was screening for. Well, it is, but like they were not caught through our screens.
Yeah.
Rather, they were caught because like visual.
Yeah.
So I don't know. I actually don't know why we have so many right now.
Because that's what I was kind of thinking too. Like the NCAA, you know, they did their survey over the summer. I feel like I've talked about it a ton because it was kind of big news because the NCAA has put a big push on mental health. So they did their summer survey and found that, well, mental health is still a big problem within athletics, which, I mean, no one was going to say like, oh yeah, of course it went away. I think some of the thinking could be athletics or athletes in general already underreport mental health. So maybe, you know, the reason we're seeing that survey, it's not that the problem's getting worse. It's not like, oh, what we're doing isn't working. No, maybe what we're doing is working. And more athletes actually feel more comfortable and are willing to be like, yes, I do need help.
Right. Now, I also have had through our screens, which we do on our health screening, I have had student athletes who do mark a bunch of yeses to our questions. And then we make an appointment with them, with our mental health person, and they're no longer interested. Like they ask to see someone. Yeah. And then they either no show or like it's too much of a hassle.
That's
so
tough.
There have been some of those.
Yeah.
It's like, okay, well, maybe you're just not ready. You know, it's like you see it, like, but you know, you also have to be ready.
Yeah.
So.
No, yeah, absolutely.
But you know, there's a spectrum to mental health where you could have someone who is just in a little bit of distress.
Yeah.
And you can have someone who needs to be admitted.
Oh, 100%.
And needs to be seen like it's emergent. It's right away.
Yeah, oh, definitely. And that's what, you know, a lot of times makes mental health stuff so difficult is because there's such a wide spectrum of what's going on, but it can turn really quick. So you can leave a conversation a lot of times feeling like, holy smokes, like I'm anxious and like, especially if you're in a place that doesn't have such readily available resources. You know, like biggest example, like, you know, I've been in a lot of places where I can just walk the student athlete over to get triaged and they'll see them right then and there in that kind of like somewhat of an emergency, right? Like an emergency would be like dialing 911. So not like straight up that much of an emergency, but something that like, yeah, you need to be seen like now. And, you know, that's super nice because, you know, that's your fail safe. You know, like, hey, this is an option. We can do this. Whereas I've also been at places that have none and you're kind of left with like, here's like, it's not a 911 emergency, but it's also like, dude, you need to be seen like now.
Right.
So you leave those conversations just like, man, dude, like, I hope this works out.
Right. So just a little teaser for our webinar, our mental health webinar we did for Student Leadership Committee. I actually made our mental health EAP, and based on NATA consensus statement, I broke our referral options up into 4 categories, starting with emergent, urgent, less urgent, and non-urgent, I believe.
Yes.
And all 4 of those, depending on what you assess their risk level is, there's then steps on what to take for each.
Yeah.
And I think it's so applicable that you can take it wherever you are, and you can apply it depending on what resources you have.
Yes.
That way you have it ahead of time. Like, okay, if I have someone who is dangerous to themselves or can become dangerous,
yes, this
is what I do. If I have someone who I don't need to follow up with as regularly, this is what I can do.
Yeah.
But why don't we jump into our first story?
Let's do it.
So this one's from Caroline D. She said, I work at a boarding school. We have a school counselor that works with us closely. Last week, I had a hockey player get off the ice during practice having a panic attack. another student came to get me to help. I calmed them down, did breathing techniques, and told them that there are no consequences for taking care of themselves right now. That's a good line.
Yeah, that is.
The athletes' parents were blowing up their phone, telling them to get over it and get back on the ice. You could tell that this athlete's parents were a negative influence on their life. Hockey seems to be a trigger, and they have had to get off the ice multiple times during practice. After the athlete was calm and got undressed, I called my school counselor, and she met the athlete back at their dorm. From there, the athlete was set up with an off-campus psychologist and began taking anxiety meds. The athlete is still playing hockey for now, but we are working hard to make sure that everything that the athlete is doing is in their best interest.
Oh, yeah. That's tough.
Parents
sometimes home is the stressor.
Mm-hmm.
That's really tough.
Right. And especially in this situation, home might be the stressor, and you would think hockey would be an escape.
Yep.
But obviously those two are tied.
Yep.
And that is also what makes it really tough.
Yep. And that's not an escape anymore.
No. I've had a performer whose trigger was going to her place of work to perform.
Mm-hmm.
And she had a panic attack during one of our shows.
Uh-huh.
Which ended up turning into just an absolute frustrating situation that I've shared on this podcast before. But essentially, she had a panic attack. I got called to the stage. I go to the stage and I meet her off the side. She is constricted they have these beautiful ball gowns. She was constricted by this ball gown, so we take that off so she can breathe better. I work with her on breathing. She didn't know where she was. Initially she couldn't really talk.
Yeah.
She didn't know who I was. And then obviously I was getting the situation under control, but where we were, it was a place that, we had, firefighters and nurses like on call.
Yeah.
Which there wasn't very good interprofessional education there, and I think that was frustrating on its own. But essentially, when I was called to the stage, these other professionals were called as well.
Yeah.
And so immediately, once the firefighters got there, they took over, which I handed over care. But the thing that was really frustrating in that situation was that the firefighter who was responding absolutely had no care about mental health.
That's tough.
And because someone, I don't remember if it wasn't me. Someone had told the firefighter she was having a panic attack.
Yeah.
And this wasn't her first one.
Yeah.
And she, I think she was sitting up at that point, because then the firefighter, like behind her back, mouthed, shook her with like big like jazz hands.
Oh my gosh.
Like, come on.
That's terrible.
Yeah, that is no regard for
no.
Yeah. It frustrated me to no end. Still to this day, and it was years ago.
Yeah, 100%. As it should.
Right. I was also like annoyed that I had the situation under control and like it was taken from me, but you know what? Sometimes you just have to get over that and do what's in the best interest of the patient.
Yeah.
Which obviously the firefighter was not, but
yeah.
Yeah, but
what can you do?
I know, it was frustrating. But I think, that was also, I know mental health has come a long way, but I think then it wasn't as big of a topic.
It was pre-COVID.
It was pre-COVID.
I feel like COVID really put mental health in front of even the most resistant of people. Mm-hmm. And made it a lot more like, hey, this is real. Like, this is a thing that's affecting everybody. Because I think a lot of those people that were kind of like, I don't want to say doubted it or like didn't take it as seriously, COVID probably made them face it themselves. Right.
At least to an extent.
Yeah, 100%. You can only be locked at home for so long.
Right. Do you want to go into the next one?
Yes, this is a gem from Jen. This is about the first time I ever had an athlete go to the hospital for a mental health issue. Men's lacrosse coach brings in an athlete who couldn't catch his breath. They were doing conditioning as a part of fall ball, and it was a tough practice. Okay, kid's probably out of shape. Let's calm him down, regulate his breathing, and get him some water. The whole 9. To be honest, I'm pretty good at the whole getting people to regulate their breathing. In fact, I'm really good at it. However, I started to realize something was wrong when other symptoms started presenting. Every time we got his breathing sort of regulated, he'd twitch or move, and then it would start again. He started complaining that his heart was racing and his hands and feet were tingling. Then he started to get restless and agitated. His BP was elevated, and I was beginning to get worried about him passing out. I called the ambulance and had him transported to our local emergency department. He made me promise to meet him there, so I said I would because it was the only way he'd get in the ambulance. I've never been in a psych emergency department room before, and I never want to go again. It's a very scary place. Ours, and I'm sure most, are very bare. The beds are basically a bare mattress on cement blocks. No sheets, no pillows, nothing. I realize all of this is for the patient's safety, but it's still weird.
Especially if, you're living your normal life and then suddenly
you find yourself in that place.
Right. That's really scary.
100%. Especially when you're in that moment.
Mm-hmm.
The kid was laying there crying, twitching, talking about how upset he was, how his parents were going to be mad, about how coach was going to be mad, etc. Well, it came out that his parents had recently separated, and the divorce wasn't going particularly well. All I kept doing was listening and telling the kid that he was safe and we are going to get him some help. Over and over. We also tried the 5 things to focus on. I had him playing scales with his hands to get out some of the energy. Then his mom showed up. I understood why he was having an anxiety attack. I didn't think it was possible, but she made it about her. The first thing she said to her son was, "You need to calm down." Yes, because that's going to work. I never thought of that. You're a genius, lady. Finally, the doctor pulled her out, asked me to come in the hall, and we all chatted. The doc made it clear that the son needed some meds for his attack and then to see a therapist. Good, all good. Mom says, well, I need to be in there with my baby. To Dad, you can't be there when I'm there, when I'm in there. I pipe up with, we are all concerned with what's best for the kid's name, and we need to act like the adults we are and put all of our energy into making sure that he's okay, which means putting your stuff aside for an hour or so. Mom didn't look pleased with me, but I was done with her nonsense. Doc looked relieved that I said it, and so did Dad. Anyway, the kid ended up being fine. He went to therapy, and I kept my job. And we need a better approach to psych emergency departments. You know what? Hey, you kept your job.
Yeah.
That's good.
Obviously this is a more extreme example. And,
big time.
And I think this also goes to, I feel like a lot of people who haven't really experienced mental health, this is kind of what comes to mind.
Yes.
And I think it's important to recognize that there are people walking around you who are dealing with mental health who may never have to come to this.
Yes.
And I think that it's important that we see the extreme cases like this, but we also recognize that it's more prevalent in the minor side of the spectrum than we think.
And also too, like, obviously those departments, like, the psych emergency department, or like if you're going for a psych eval and stuff like that's basically just for, hey, we're trying to keep you alive.
Right.
Right?
I mean, that's basically what the emergency department
exactly.
So.
Right. We're just trying to keep you alive and get you to your next step. So yes, like, all that is very serious, and like the way it's set up is a very serious thing, but mental health doesn't have to be like that to be debilitating. Mm-hmm. Like, people can have significant mental health conditions that affect not only obviously athletic participation, but literally their daily lives.
Mm-hmm. We do have some stories from athletic trainers of how they work through it at work.
Oh, nice.
Yeah. And actually, our next one from Charissa D, she said, we lost the Olympic gold medal because of mental health or a lack of mental health on our team. I can't go into too many details, but the team didn't play as well as they could have because of that mental fitness piece was not there during the Olympics.
And I've definitely seen that.
Mm-hmm.
And you know, it's not just depending on how bad of a situation, it can make the workplace tough, even if it's not happening to you, but that much negativity that's creating that mental stressor, it affects everybody.
Well, it's infectious.
Absolutely.
Energy. Especially people who get their energy from other people.
Yes.
I mean, not to say that it doesn't affect everyone, but like it could affect some more than others.
Yes.
I think it also depends on how much you take on personally.
Yeah, definitely.
So someone comes to you and does something really vulnerable and they open up. What do you do?
I mean, my biggest thing is it kind of depends how the conversation starts. Like if they're very vague, you know, I like to just hit them with the simple, do you want to talk about it?
How have athletes come to you? Like how have conversations started with you?
I've had a good mix. I've had some that are kind of like that where they tell me something's going on and I just ask, do you want to talk about it? And they're like, yeah. I've had some that I had to dig a little. Like my biggest example, and I'm sure I said it on the podcast before, but you know, the student athlete who is normally someone who could take a joke, who would like dish it right back and like all that, one day was just, she wasn't having it. People tried to like, you know, just kid around with her and she took it really hard, crying, stormed out of the room. It's not like her. So I went out, you know, chatted with her, and that's when it came up that, you know, she thought of suicide the night before. So like I've had a mix. I can't even say which one happens more than the other. It's usually pretty random.
I think sometimes people are just outright with it.
Yeah. Some are very open.
And then the ones that I've had, I don't know if confrontation is the right word, but the ones that I've had to like confront, if that they've had cutting marks, I'll notice them like during rehab.
Yeah.
Like for example, I saw some thigh cut marks during rehab. When someone was wearing shorts when they don't normally wear shorts and they kind of rode up a little bit.
Yeah.
And then after rehab, I was like, hey, why don't you meet me outside so we can talk about your plan for practice or whatever. And then I said, hey, you got time for a walk real quick? And then we just like walked away from the ATR because it was busy. And then I just said, hey, you know, while you're doing rehab, I noticed on your leg that you have some cut marks. Are those recent?
Yeah.
Or do you want to talk about them? And then she kind of like didn't say much.
Yeah.
And then, but just a little bit more digging of, all right, well, I just want to make sure you're okay. You know, it is something I noticed, and we do have resources on campus. So.
Yeah.
And then like once she recognized my intention, and then she opened up a little bit more.
Nice.
Which actually Andrew H submitted one of my absolute favorite responses for a question to ask. He said the easiest opener is, you don't have to tell me anything you don't want to, but I just want to know if you're okay.
Yeah.
That's totally sets the space.
Yeah. And I like saying that too, because like you can tell when they're a little hesitant and like, look, I don't need you don't need to tell me anything you don't want to. I just want to make sure you're good.
Mm-hmm.
Yeah.
Because that's not our role. Our role is not to be a mental health professional. Our role is to recognize when they need a mental health professional.
Yes, definitely.
And I think that's something that can get blurred.
Yes.
And I think we feel like we're not comfortable with it because we don't know enough about it, but we know just enough. Like,
yes.
We don't need to know how to be a mental health professional because we're not.
Yes.
So I think that's a really great way to open.
Yes, the one abnormal psych class, that doesn't necessarily constitute the ready to deal with it phase.
Right. Some other questions that people submitted are, would you like to talk about what's bothering you? Are you safe right now? Are you safe tonight? You can ask about family life. You can ask about their support system.
I like the support system.
That's one that I use a lot.
Yeah, I like that one.
Yeah, because especially for someone who, most recently I've used this for someone who I had a mental health concern about, but I, based on like previous history and our discussion, it wasn't ready for a referral. Yeah. It was more of a, let's watch this and see if we get to the referral point. But this person had a really great support system, which I did check in with them to make sure that they were utilizing.
Yeah.
So that's a really great way to kind of dive in and figure out, okay, what's the level of risk here?
Yeah.
So this is actually really interesting. Charissa D said, getting mental health first aid certified is the most basic first step. The USOPC gives this course for its medical providers as a resource to help those hard conversations. Mental health first aid is a great way for medical providers, especially ATs, to feel more comfortable with having these types of conversations and will be better equipped to handle mental health situations.
Nice. That's awesome.
Yeah, I had never heard of that. So I thought it would be, this would be a perfect place to spread the word.
Oh, definitely. I definitely want to take a course too. That'd be awesome.
Wasn't there a lot at NATA on mental health?
Yes, NATA had a lot. FWADA's put on some stuff too.
Or maybe I'm thinking.
Well, NATA did have some. They even had a pre-conference
right.
workshop.
Yep. Yeah, it's a big topic.
See, that's when I wish there were like 5 of me, because then I can go to multiple courses at once.
Right.
Just saying.
For another way when an athlete opens up, Spencer P said, focusing on the controllable versus uncontrollable is essential. Find out what we can focus on that is something attainable and doable to help center and calm ourselves down. Tackle small pieces of the puzzle instead of the greater picture. Yeah,
and I think what's cool is using that kind of idea behind like talking to someone or finding the correct resources, because that is something that is 100% in the control of that patient. That is a small thing that, hey, they don't have to do it alone. Someone can help, right? Like we can help. Like it's the same thing, like walking over with someone, right? But it's still, it's their call. They get to do that. No one else is going to do that. And no one else can do that. They get to do that. So that is true.
So this next one is from Hailey P. And she said, I'm an ATC studying sports psychology for my master's, working towards my CMPC, which is a certified mental performance consultant.
Nice.
And this requires completing a degree in sports psychology, 400 hours of mentored experience with a CMPC mentor, and passing an exam. So Hailey said, I work with adult collegiate soccer players on mental skills training. I meet with athletes via Zoom weekly during the season and bi-weekly in off season. So I asked her how they started because, I haven't heard about too much of that. So I was like, oh, like, how did you get this like so often? And she said the Zoom started through a mentorship class at my school where she's going for her CMPC, where I meet one-on-one with someone in an athletic population. My mentor at school guides me virtually after viewing my Zoom recording with the athlete's permission and gives feedback on them. Actually, something that we did in grad school, because we had a psychosocial class, and we had to like role play with one person opening up about a mental health issue, and then the other person being the clinician and kind of talking through that conversation and figuring out how to navigate through that. And so we had to like present on it and present what a conversation looks like a back and forth.
Yeah.
So
that's awesome. That's really
not
cool.
only did we get to see like practice it in real life with like people watching, which was terrifying, but also we got to see how other people navigated their conversations.
Oh, that's awesome. That's cool.
Yeah, which is super vulnerable.
Oh, big time.
Yeah, I mean, that's kind of the
whole point
of mental health, right? So anyway, Hailey says, the mental skills training Zooms are all unique depending on their mental health journey, but my favorite ones I use are stress relief, imagery, reframing, thought stopping, and self-talk. I also work with them on goal setting using the SMART format as well as personal stress relief toolkit. If an athletic trainer wants to address this with their team, I highly recommend a CMPC or one that has a degree in sports psychology, but ATCs can implement these for sure. Something that also needs to strongly be clarified is that we are not psychologists. Only those that went to school for PsyD or clinical psychology own that title. The proper way of referring to us can be in many titles, just like we clarify athletic trainer, not just a trainer. I related to that when I learned in school about this.
Yeah, big time.
So I actually asked her a couple of those things that she was talking about, if she could give like a little blurb about each one, because these might be familiar to like some of you.
I was going to say, everything she talked about, I remember because like when I was in school, I was a psych minor, but that was a separate department. So that was like a very clinical psych kind of viewpoint. Mm-hmm. And within the athletic training education, within the actual, department or like the college itself, there were a lot of sports psych stuff. So I took a lot of sports psych classes too. So everything like the self-talk, reframing, thought stopping, like I definitely remember all that. Mm-hmm. And it is true. It is, athletic trainers can definitely use this stuff, like the imagery, like that's actually a really good rehab thing to do. Mm-hmm. The barrier though that I have noticed is like, okay, so we did an imagery exercise one time in class. Mm-hmm. So it's like, I'm going to try and recreate this. Like, you're right. I'm not the pro at this. Yeah. And also too, it does take time, like imagery, because you got to like sit down and talk through a script. Well, not necessarily a script, but you have to talk them through it, help guide them through their image. But anywho, yeah. So definitely applicable, but there are certain times where you do want the credentialed professional to handle that.
Right. And this is not talking about like big changes. This is like little things that you can address, like how Jen was talking about the 5 things. I do that with, or like grounding, where you're like, okay, what can you see right now? What can you, what do you feel?
Yeah.
What do you hear? What do you taste?
Big time.
What do you smell? All those grounding things are like, hold something in your hand and like describe it, or like anything that kind of takes their mind off of, like just a simple task, or kind of like reminding them. Mm-hmm. That's a really good way to have someone kind of, if someone is dealing with and like acute mental health.
Yeah.
It's a good coping.
Oh, big time.
So Hailey describes self-talk as grab Post-its and put these statements in different places you are often in. The car dashboard, the locker room, or in your bag. Every time you see the statement, pause and repeat it to yourself at least 10 times. A good way to use your powerful inner voice is to use positive self-talk. This will affirm that you possess the skills, abilities, positive attitudes, and beliefs necessary for success. The self-talk prompts I like to use are, I can, I am, I will, I have. I work together with the athletes on finding positive, productive statements to write down, and they make a list and have that by their bed so they see the full list morning and night to repeat to themselves, and the Post-its of random statements. I also work with men's soccer, and they like to use white tapes and other things. Another thing I tell them, if they tape their wrists, their shin guards, or even write it on their boots or their cleats. Yep. A positive statement or symbol to remind them during the game. This goes hand in hand with goal setting. If they have a goal they'd like to achieve, I use this technique as well and have them write the goal or something that represents the goal on the white tape. Yeah. So this actually, we have someone in our department, and I have yet to figure out who it is, but they put Post-its around specifically, I don't know, I mean, they have been like in other places before, but specifically mostly in the women's bathroom, like on the mirrors, on the stalls, like behind, like when you walk in, but also like the door of the stall, the walls. And they say different things like, you are worthy.
Oh, that's nice.
And they thank our custodian.
It's the positive self-talk fairy.
It really is. And sometimes they get taken down and more appear. And I'm like, I have no clue who this is, but it's so nice.
That's awesome.
And there's some with like drawings on them, like a flower, a little bee. And they have like different sayings like that go along with the drawings. But I'm like, wow.
That's awesome.
Yeah. It's so nice. They're really nice to see.
And the thing too with like self-talk is it is very powerful and it's a very effective tool. That's why obviously negative self-talk can be very tough to break because it is so powerful. So with positive self-talk, how our professor kind of like laid it out there is, you know, it is very powerful. It's very strong, but you also have to believe the words you're saying. I mean, if you say like, oh yeah, I'm awesome, right? Like that's not effective.
Right.
Positive. You have to really feel and believe that, yes, I am awesome, or yes, I can do this.
Right.
So that is definitely one thing that is kind of like that caveat with that self-talk is you got to go for it.
Mm-hmm.
Like with rehab.
Right.
Like you can't just sit there and do like, I'm going to do glute bridges and like they're just going through it. No, you got to do purposeful glute bridges.
You got to get that work in.
Get that work in.
Okay, so reframing. This is a form of self-talk and it's picking a negative thought and thinking about how it can be changed into a positive, productive thought. An example, rehab. Something ATCs may hear often. It's not strong enough. I need more rehab before testing it in training. And you reframe that to, it has been tested throughout rehab and it has survived. It is ready.
Ooh, I like that one. That's cool.
Mm-hmm.
I like that.
Mm-hmm. Or even reframing an injury into, instead of, man, why did this happen to me? It just ended my season.
Yep.
To now I have the time, the dedicated time to do rehab, get stronger for next season.
Yep. Yeah, 100%.
So it's just changing your focus. Thought stopping is another one Hailey said. Is quite literally the word itself, stopping negative words. Using visualization, whether it is a stop sign, mute button, a pause, or a color that represents stop. Sometimes with athletes, I almost have them imagine a whistle, and hearing a whistle universally means stop for them.
Yep.
And whenever they have a negative thought, picture that big stop sign or hearing a whistle and turn it into a positive, productive thought. With thought stopping, I use the CAR technique, which is catch it, address it, redirect it, which is the changing.
Yeah, nice.
Mm-hmm.
That's awesome.
Mm-hmm. That also takes a lot of self-control.
It does. Yeah, but no, that's awesome.
I know there are a lot of people who will say things like, oh, I'm dumb, I'm stupid.
Yeah.
And I try to, I mean, depending on who I'm talking to, but I try to, hey, no, you're not. Change that wording. Because after a while, it kind of gets ingrained in you. And
again,
you just say it without
negative self-talk.
Right.
Yeah, no, same thing. Like when someone says that, I'm like, no, you're not.
Choose something else.
It just goes back to one of the most important things that you've said. The brain is an amazing thing.
I did say that. You heard it here.
Yeah, heard it here first. You know what's funny is I heard it when she was asleep.
Yeah, sometimes I sleep talk. Apparently about brains.
Being amazing.
Yeah. So this next one is actually a couple tips and tricks.
Okay.
So from Katy H. I think athletic trainers are the most unique healthcare professionals because they develop relationships with the patients before you manage and treat their injuries and illnesses. Mental health and physical health go hand in hand. It is so important for ATs to know who to reach out for their athletes, but also staff who work with athletes too. I wish we learned more about managing mental health concerns at school, but just like injuries, you learn from actually doing it and going through the experiences. We've been working to build a better connection with our on-campus CAPS department, but we also have an off-campus connection as well. Our goal is to have someone or more than one person housed in our athletics department specifically. The biggest tips I have are to remember in certain situations that may be overwhelming to you Just keep calm, as we know how to do when dealing with a physical injury. Know your emergency action plans. Also, never be afraid to call campus police or 988. Care about your athletes and patients and show you care. That can be as easy as having conversations about anything and getting to know them. Also know there's only so much that you can do. Often you run into athletes not wanting help or to talk, and that's okay. Some aren't ready, but just let them know you are there to be able to help with the next step.
Yes, that's very important.
Some ATs will be afraid to say the wrong thing, but in those cases when you aren't sure, just listen, acknowledge what they are saying and feeling, and repeat it back to them.
Yep.
And I think that's a big thing too, is we are so concerned about us when in mental health we should be concerned about them.
Yes.
And listening, understanding, just providing that space and allowing them to feel heard is sometimes just what they need in order to recognize or be ready to see someone, or even maybe that's all they need so that they don't have to see someone.
Yes. And also I feel like the repeating it back to them part, I do think that is a school of thought within psychology.
Oh, really?
When they're treating patients. Like some people, that is a certain school of thought too. Like obviously they do a play on it. It's not just like Siri reading it back to you. But I do think so. Yeah, that does work.
Something that I say to my athletes who do not take me up on the offer for referral are, again, like Andrew was saying, you don't have to tell me anything.
Yep.
Just know, here are the resources. My door's always open. You can always come back here and just say I'm ready.
Yep.
I'll know what you're talking about, and we'll send you the referral. And no one has to know. Your coach doesn't have to know.
Yep. And that's definitely one thing that I definitely make clear with my student athletes, that your coach will not know this. Like no one's going to say anything to them. It's really up to what you want to tell them. Some kids don't really care and they'll probably end up telling their coach. And then some kids, they try everything not to let their coach find out. So I just make sure that they know that your coach, no one's going to be telling your coach.
Yeah, that's a big one.
And sometimes it does get tough because, the mental health piece is very important. It's kind of like the same thing, like when you schedule a doctor's appointment for your student athlete, right? Like sometimes the only way you're getting this kid in is if they miss practice.
Right.
And, at the end of the day, like you kind of make that executive decision. Well, this is more important. You need to go to the doctor. It's kind of the same thing, like in this case. So obviously that does kind of like, well, the only time I can go is like during practice and I don't want coach to know. I keep it generic because naturally the coach is going to ask, well, where was this kid? They had a doctor's appointment.
That's all they need to know.
Yep, that's it.
Even that. You can even make up something that's minor.
Yep.
Or I don't know.
Yeah, like sometimes, gen med issue, wasn't feeling well or something like that.
They're not feeling well.
Yep, and that's usually about it. And they usually are like, oh, are they going to be good? Yep, probably.
Yeah. Okay, so now we're going to move more into the athletic trainer side of things.
Ooh, I like this.
So our first one is about a loss.
Yes, this one's by Sofia W. When I was in grad school, we had expectations that we had to be at our clinical site for everything unless we were in class. That's fine, I can handle that. My dad had passed away shortly before I started the program, so I was struggling with that. I remember crying in the athletic training room just from being exhausted and so overwhelmed. My favorite preceptor, Brenda, sat me down, talked me through it, and sent me home for the day. While we talked through it, she told me she keeps a folder of every wonderful thing anyone has ever given her or written about / for her. She showed me years of things athletes had given her, and it was really sweet. She also encouraged me to see a therapist. Next day, I started my folder and saw a therapist. I've now come to terms with my dad's passing, and whenever I have a tough day on the job or feel a little burnt out, I go back through my folder and just remember all of the lives I've touched. Yeah?
I am a little speechless on this one, but also I feel like this is just such a good way to honor yourself. And I think
big time
for someone who is also maybe not struggling with mental health, that's a really good way to deal with burnout too.
Absolutely. And it's a reminder that everyone likes to say, yes, this is a thankless job, but there are a lot of thank yous.
Mm-hmm.
A lot of thank yous.
Mm-hmm. And I mean, obviously some teams more than others.
Yes.
And some populations more than others.
And also in their own different ways.
Right. Right. I mean, my football team loves to buy me food and make me food.
You know, whatever. Okay.
Are they going to write me a card? Probably never.
Not. But you got the food. But also, like, I mean, I feel like that'd be a weird card from football.
I have had a card from...
Thanks, bro.
I have had a card from football. And it was from high school football.
Uh-huh.
And one of them wrote me a poem.
Oh, yes. I remember this poem. You're right.
2 things to take from that poem. 1, they called me the GOAT.
Yes.
And 2, they asked me to prom.
Look at that.
So, needless to say, I did not go to prom with this kid, but...
I mean, yep, there you go.
But you know what? A great thing to look back.
Yeah. It was a thank you nonetheless.
Right. So, Sophia, sorry about your loss.
Yes.
But I'm glad that this...
Mm-hmm.
I just really want to share that with what came out of it.
Yeah, definitely.
So this next one's from Sarah Y. She said, I have struggled with both anxiety and depression for years. There are times where I go to work and it is exhausting to put on a happy face. A lot of the time I can function well enough that it doesn't affect my work. When I'm having a particularly hard time, I will do simple things like color in a coloring book or pull out my yoga mat and do yoga while watching practice. It helps ground me and make things tolerable. I also make sure to take my medication so that highs and lows are more of a middle ground, and I am struggling less to do my job properly. I have sought out counseling so that I also have an outlet and someone to talk to.
Yeah, and see, that definitely goes to, like, show, like, hey, this isn't, like, obviously emergency department, but still, it could be very debilitating.
Mm-hmm. You know, there are some times that when I need a break, I'll just go make some heel lace pads.
Interesting.
Because it is so mind-numbing. You can just kind of zone out. It is a simple task, and no one is asking you to do anything.
Yeah.
I think that's also something in this story. Sarah says it's exhausting to put on a happy face. This profession is such a naturally giving profession.
Yeah.
We're serving, we are giving rehab and treatment and asking everyone else what's wrong.
Yeah.
But no one's asking what's wrong with us.
Yeah.
So when someone comes in and they're expecting us to help them, that is hard when you are not in your full capacity.
Well, also, let's also highlight the fact that, like, we don't have a place to just walk in
100%
and be like, oh, hey, I don't, from a physical aspect, like, oh, this hurts, all right? Like, you know, or to just talk to somebody too. Mm-hmm. So yeah, that is tough.
Mm-hmm. So I know this next one I really resonated with. This one's also anonymous. They said, I deal with a skin picking disorder called dermatillomania. It's a form of OCD for me, but can take on other forms based on the individual. It greatly affects me as an athletic trainer because I will often have scabs or wounds on my hands and fingers that need to be covered up. It's been very hard to find a brand of Band-Aid that can survive working an AT's workday, so sometimes I will opt for rubber gloves depending on what I'm doing. Among other things, my picking is triggered by stress, so game days are very difficult days for me mentally. Something that has made me all the difference is having a fidget, like a sensory ring or a poppet in my pocket at games, so I can keep my hands off my fingers. I'd be happy to talk more about dermatillomania if you have any questions.
Nice.
Yes. Which, go ahead.
No, I was just say, yeah, like that's, again, it shows how it can affect the day to day, you know, between causing the wounds on the hands and, like, you know, obviously, you know, that could cause pain and, you know, also having to put Band-Aids on, gloves on, someone might ask, and like, it definitely could. Yeah, it affects the day.
I have a lot of scabs and wounds on my hands a lot of the time, actually, even right now. And Randy got me a sensory ring to help with that.
I did. I did.
Also, I have had people comment on it. And when I was working at the high school, I had a really bad, specifically on one finger, I had it really, really bad.
Yeah.
And I was having to buy all my own supplies.
Yeah.
So I only had red Powerflex. And of course, like that's not very hidden.
Yeah.
And so I was trying to keep it covered. Like I was wearing gloves and stuff, but like a big red Powerflex finger.
Yeah.
And like even my coaches would say stuff.
Of course. And like, I don't know, it makes it very like, you don't want the attention brought on to that.
Right. It was during a game too.
Yeah.
Like, come on, guys. Let's not focus on my finger. Let's focus on the field. Yeah. But I also like this because it shows how mental health can also present physically.
Yeah. No, definitely. Big time.
I just watched a video actually on this girl who said she lost a lot of weight.
Uh-huh.
And everyone was commenting on, oh my goodness, you look so good. And she said, hey, I just want to like put out an announcement, like a little reminder that we should not tie like weight loss or that to a positive thing.
Yeah.
Because she had unexpectedly lost her sister.
Yeah.
And she physically couldn't get herself to eat.
Yeah.
Which is what caused her to lose all this weight.
Yeah.
And so she was like, it wasn't helpful or healthy for me. And so it shouldn't be rewarded.
You shouldn't be like, hey, great job.
Right. And you never know what is going on.
Yeah.
You want to read the next one?
Yes. This one is by Charissa D. I'm still working on my own mental health. Big time. Going to counseling has helped tremendously. It's given me a place to sort through the mess in my own head so that I can be a better provider and mom and human for everyone around me. Having a support system has also been huge for me, knowing who my people are and that I'm safe with them no matter what. That's true.
Mm-hmm.
Having a support system is huge.
Very huge.
Very huge.
And not necessarily something to rely on.
Yes.
But something
there.
to something to turn to.
Yep. Something that's there to at least support you.
Right. And that comes in different forms.
Yep.
Whether it's family or whether it's friends or people who you just interact with a lot.
Yep.
There's a lot of different ways you can get support from others.
Big time.
Okay, so this next one's from Katy H. She said, actually, when you were talking about COVID, it kind of reminded me of this, but I didn't want to jump ahead. When COVID shut everything down, my team was #1 in the country, and going into the NCAA tournament, I was heartbroken for my players and our staff, which I'm sure a lot of us.
Big time.
#1 in the country, and oh my goodness, like right before.
It's what could have been.
Right. It was difficult, but 2 days later, my AT staff experienced another grief of my mentor and boss, and one of the best humans passed away.
Oh, man.
It was probably one of the hardest times in my life. One of the ATs had someone from AT Cares reach out to me. It's a program where ATs check on other ATs to chat and be an ear to listen when they go through something difficult. It was really helpful to have someone to talk to. She called and checked in a few different times over the next 3 months.
Yeah, absolutely. We've talked about it before. AT Cares, it's a great program. Mm-hmm. And, I hope more people are knowing it and able to utilize it.
Mm-hmm. I think this is the first time that we've actually had a personal experience with AT's Care submitted.
I think you're right. Yes.
So I thought that was really
really cool that's awesome
to hear from. And then we just have one more. This is actually not specific to athletic trainers, but just kind of a transition into coping.
Perfect.
You want to read it?
Yes, this one's by Anonymous. My bachelor's is in health and behavior with a specialization in mental health. When an athlete leaves their sport, I've seen quite a few have an identity crisis and suffer from depression. Sometimes they just needed someone to talk to and help find out their other passions. I helped a couple get started in competitive golf and archery, and it seems like it's working so far. I found it helpful for them to find a way to be competitive still, and even in a couple instances, still be part of a team. Yeah, that's true. Losing a sport, because these student athletes, anytime you have a student athlete, when you ask them like about themselves, they always hit you with oh, I'm a soccer player. I'm this, mm-hmm. Not I play this or right. I run this, right? Yeah, don't say play track. You're going to lose a lot of points with those kids, right? Like they identify as their sport.
Right.
And plus, like they've been doing it more than likely they've been doing it since they were kids of some age.
Okay, but also the amount of slack that they get if they don't identify with it, if they just think it's a hobby.
Yes.
Their coaches.
Yeah, now it's negative.
Right.
Oh, you don't want it enough.
You don't want to be here. You're not all in.
Yeah. It doesn't have to be that way.
Right.
So yeah, no, it definitely is tough when even like obviously when an athletic career is cut short because of an injury, right? That's very devastating. But even the mundane, just like, oh, this person graduated. Well, now that they're like, if they graduated college, right now, unless they turn into a professional, like that's it. Mm-hmm. It just kind of like stops. And like, hopefully while they were in school, hopefully they found something that they're also passionate in that they can pursue. But for a lot of athletes, that still isn't enough. And they just lost the thing that meant probably the most to them.
Which I also feel like applies to athletic trainers in general too.
Yeah.
Because when people leave the profession, there is still some sort of identity that you've spent countless time in school and as a professional being in this career that you thought you would be in.
Yeah, it's a way of life.
Right. And then you leave and that there's still a little bit of that identity.
Yeah.
And there's nothing negative about leaving. It's just that is a side effect of.
Yeah. Doesn't make it easy.
Right.
I mean, there's stuff like for someone who's leaving athletic training, there's stuff that at one point attracted them to athletic training. Mm-hmm. So to say you're kind of leaving that, right? Like that's still the sad, or not the sad, but like the hard part.
Mm-hmm. Well, even like if you are moving like from a place to a better place, it's like, well, you're still going to be sad about all the memories that you had at the place that you moved out of.
Yeah. Cause no, for sure.
Or even like jobs, like, even though you might have not really liked that job, there were still a lot of people there who you might have really liked.
There's still the positives that were really, really positive.
Mm-hmm. Do you have anything to add as far as the athletic trainer mental health? Or any like personal?
Not off the top of my head. I know for me, I know I'm pretty hard on myself. It's the competitiveness thing for me. I always strive to be the best. And so if there's ever a situation that I felt I didn't do the best, it's always I'm always harder on myself about it. It's funny that when they talked about coping, I have some really cool coping things that I can turn to. Obviously, one is you.
Oh, thanks.
You and our baby dog are big coping mechanisms because obviously the support, but also like our dog doesn't care what happened on the day.
No.
The minute we come home, it's the biggest smile. Happy to see you here. Right. So stuff like that, it's that escape. It's that you are still loved, even though maybe you didn't do the level of whatever you're doing to what you thought you should have.
To the expectations.
Yes. And so that's always, you and our our arrow have always been really big supports for me. And then also reading. Like, we joke around how nerdy I am, but that is a really good escape for me because I just like learning more. And again, it's a way that I feel like I'm getting better. So it's not like I need to do this to get better. No, like I feel like I'm getting better because I'm just learning more. Mm-hmm. So that's always a great escape for me as well.
Can you talk a little bit about how to keep kind of a light at the end of the tunnel when you're at a place of work that you are not, that's not fulfilling you?
It's remembering why you're an athletic trainer. Because, and anytime you leave a place, like always, the student athletes are always sad. And some of them probably wonder why. And the first thing that we always say is it's very rarely them. Mm-hmm. And that's what helps, is when you can focus on them. Like for me, that's what it was. Like focusing on, I am going to do my best for them. And, getting the energy from them, that I've noticed has been a big help. Because they're a great way for me to escape because, they tell me their problems too. Mm-hmm. Right. So more than likely, some of the complaints that I have, on a place, they might be able to share that. Or same thing, like I love being an athletic trainer. That's what I do. I probably identify as that as well. But that's why I do this job. I do it for them. So that's what helps create that joy. So if you are in like a negative place, kind of like that reframing, right? I'm now taking my focus. I'm focusing on what I can control. Well, that's how I take care of my student athletes. Obviously, there's some processes that might affect that. That might be why you don't like that place. But there's still a lot that you can control with how I take care of my student athletes, how I interact with the student athletes. So that if you're at a place that's pretty bad and you're trying to get out and it just doesn't seem like there's a light at the end of the tunnel, sometimes those student athletes help remind you that there is. And I just unfortunately have to be patient.
Right. My least favorite word.
Yes, you don't like the patient word.
I think something else to bring up too is that when you are dealing with someone who is having a mental health crisis or situation, that you absolutely have to do what's best for them, but you also still have to keep yourself in mind.
Yeah.
And I think as someone who has been involved in a lot more mental health recently, I've realized what a toll it's been taking on me.
Yeah.
And you just have to take steps to ground yourself and make sure that that energy is not overwhelming you or consuming you, because what an athlete is dealing with is not necessarily what you're dealing with.
Absolutely. Also, another great way is shout out to Erica and her burnout course. Mm-hmm. That was a big help in just understanding how to manage energy. Mm-hmm. So that also helped. So shout out to Erica.
And the affirmations that I still use.
Yes.
There's actually one on my desk.
I cannot speak to how amazing that course was. And just kind of learning on how to manage learning how to manage those energies as an athletic trainer.
So if you guys are interested in, if you guys are like, who's Erica? What
who are we talking about?
What is this course? We took a course from Erica Marcano at Notorious ATC. I think there's some dots in there. But she does a lot of like Instagram reels and stuff for athletic trainers.
Yes.
She actually did burnout EAP, I think.
Yes. Yes, that's right.
Yeah. And we had her on for a podcast episode. So make sure you check out her. Yes. Because she is very big into all of that as well.
And if you need a refresher on kind of like what we talked about in our episode, you can check out that interview we had with her.
So I put up on our Instagram stories asking for what athletic trainers use as coping mechanisms, not just for themselves, but for their athletes as well. So we're going to put the condensed list of what you guys submitted. We're going to put that up on our Facebook group. If you guys are not a part yet, go to facebook.com/group/AT Corner podcast. Make sure you just answer that one question that asks where you heard about our podcast, and then it will automatically let you in.
Yep.
Other than that, if you guys are new, we do every other episode as education or stories. This one was a story episode. Next week, we're going back to our education, which again is going to be more mental health.
Oh, yeah.
If you want that bonus content of the mental health webinar that talks about mental health EAPs, that will be up on our YouTube.
Yes.
youtube.com/@AT Corner podcast. And then other than that, I think we are good for the fine print.
I think so.
Yeah.
Thank you for helping us showcase athletic training behind the tape. Bye.